Good morning and welcome to Morgan Animal Hospital here in Niagara Falls. We are in the back area, which a lot of people don't get to see very often, but they've let us come back here because we really want to showcase all of the special things that they do here at Morgan Animal Hospital. And joining me is Dr. Morgan himself. Thanks for having us today.
Thanks for coming in.
Okay, so you guys are leading edge technology. You guys are doing something that not too many people are doing, especially in the Niagara area. Tell us what that is.
Yeah, so we specialize in endoscopy as a whole.
Okay.
Right? And so endoscopy is just using a specialized medical camera that can investigate certain parts of the body.
Okay.
A lot of people, you know, have probably had friends and family had colonoscopies, for example.
Yeah.
And one of the things that we do a lot of is called laparoscopy, and this a laparoscopic spay is just using a kind of a specialized medical camera that goes into the abdomen, and we remove the ovaries to spay the dog with being as minimally invasively as possible.
Wow.
It's just less painful, and they tend to bounce back a lot quicker.
Do they still have to wear the cone of shame?
That's up to them. They can still use the cone of shame sometimes.
Yeah.
It all depends. We kind of know by the time they go home if they're going to be
Irritating it or not. Yeah, that's crazy. It's such technology has come so far.
Yeah.
Like when you really think about it. What else do you guys specialize in here?
So as far as the endoscopy part of it, we get a lot of referrals from a lot of the clinics in Niagara for doing things like rhinoscopy for like a sneezing dog or cat that's we're having blood in the nose, so we use a camera to go in the nose.
Yeah.
Sometimes a coughing dog, we like to do bronchoscopy and get a wash where we can take samples of the airways. Again, we have a cat here today that's getting an upper and lower GI endoscopy, which is just going into the stomach and the intestines to take little biopsies for like inflammatory bowel disease and things like that.
There's something going on.
Yeah, we also go in the bladder for any cats or dogs that are having problems urinating or chronic kind of urinary issues.
Yeah.
We also have our general regular practice as well.
I was just about to say, do you do regular vet things too?
Yeah, see lots of dogs with skin issues and ear issues, that sort of things too.
They're so sweet. They look so happy being well taken care of by the staff here. Look at that guy. He's like all smiles. What's going on? I want a treat. I want a cookie. He's so sweet.
That's the goal, is to try to make it, as positive for the pets as possible, right? So that's why we have lots of treats and lots of tricks.
Yeah, treats and tricks up your sleeve. I love it.
Yeah.
Okay, well, we're going to have a lot more coming up from Morgan Animal Hospital in just a few moments, so don't go anywhere here on Morning Live. This is beautiful Belle. How sweet is she? She's just over a year old, I think.
Yeah, almost a year and a half.
A year and a half. And what procedure are you going to be performing on Belle today?
So Belle is getting a laparoscopic spay.
Okay.
Right? And kind of we were talking about last segment is that we just go in with a little camera. Like the incisions are only 1 centimeter little incisions. We go in with the camera, and then we are able to kind of see everything easier. It's far less painful, it's far less blood, and we're able to kind of find her ovaries. We're going to remove her ovaries and spay her.
Wow.
And then so she never goes into heat again. She doesn't get a
no
bunch
puppies
of the,
for you, Belle.
Yes.
No puppers.
But she also saves her from getting some of the medical issues that can happen if they're not spayed, such as mammary cancer, which is really common in dogs that aren't spayed. So
interesting. Okay, so how old do dogs have to be in order to get spayed?
So it depends on the person and the type of dog. Typically, dogs that are like small breed dogs are usually around 6 to 8 months of age.
Okay.
Some of the large breed dogs, like Belle here, they usually wait till they have to have a heat. So usually around a year and a half. So this is kind of a typical time we would see some of the larger breed dogs.
Does it hurt more laparoscopically, or is it less painful?
Less painful. So
less painful.
There was a study done that found that the dogs were 65% less painful than a traditional spay, where you make a bigger incision and going and doing the spay that way. So if we can make it less painful for them and
quicker recovery time?
Absolutely. Yeah, so people always love how quickly they're back to normal, and some people say they don't even miss a beat. So
no, I would believe it, because I have a dog, and when she got spayed, she didn't miss a beat either, but she was a licker.
She's had a pre-med, so she's a little bit
she's a little sleepy. Belle's feeling good.
Yeah.
Belle's feeling good right now. What do you have to do before the surgery starts? Are there a lot of pre-surgical things that need to be done to Belle?
Yeah, so we've already kind of talked to the owners. We did a little Prina set up bloodstream just to make sure there's no surprises. She has her IV fluids in. We just do one final little exam here, right? You don't care, do you? You
No.
just making sure
Nice teeth.
everything looks great in here.
Her teeth look awesome.
Yeah, she's young.
Yeah. I was gonna say my 14-year-old golden doodle doesn't look like that.
And then we'll listen to her heart and lungs, and then give her her anesthetic and
Yeah,
get
and
on
then
with the
she's
procedure.
ready to go. Oh, well, I'm sure she's going to do absolutely amazing. Coming up, we're going to be talking about ticks and fleas and everything you need to do to prepare your pet for the new season approaching. But for now, send things back inside the studio. Right, Belle? Oh, you sweetie. Welcome back to Morgan Animal Hospital here in Niagara Falls. We're now being joined by Sarah, who is an RVT. What's an RVT?
An RVT is a registered veterinary technician.
Okay.
So we do everything kind of behind the scenes. We also talk to clients, but whatever the doctor delegates to the technician, we're taking blood, we're taking radiographs, we're monitoring and prepping for surgery. We're here trying to make the appointment as less stressful for them as possible, administering any medication that needs to be administered, being there for the client.
Now, if I bring my dog in or my cat, hi, sweetheart. If I bring my animal in, my pet, for an exam, am I going to get an as thorough exam by you as I would by the doctor?
Yeah, so there's a new thing, certified wellness providers. So it's an RVT that's gone through more extensive training to be able to do a physical exam on healthy patients. So as long as there's no specific concerns that a doctor needs to address, an RVT wellness provider can definitely do a very thorough exam. We're still taking the same amount of time that a doctor is taking to do the exam, but most of the time we have a little bit more time to discuss nutrition, discuss weight loss, anything like that, training that the doctor might not be able to have the full time to be able to discuss.
Yeah, I find that whenever I bring my dog into the vet and I see the RVT, it's like, not to say that it's not important work, but sometimes you guys got to do the dirty work.
Yes.
Doctors don't get to do.
No.
Anal glands, that's yours.
Correct, yep.
But you know what? You guys are so good at what you do, and I'm sure clients really appreciate that, personal connection that you have to their animals and to them, because you do have a little bit more time. You're not rushing off to your next surgery. You can talk about all the needs, because sometimes, like pet owners, we get freaked out about stuff, like the littlest tiny thing. We're like, oh, something's wrong. Let's go to the vet. Okay, so we're going to be talking about preventative measures. We're going to talk about kind of how to get your animal ready for spring and into summer, and why it's so important to do regular checkups, because I know a lot of that time that kind of falls away. But we're going to focus on that coming up in the next segment. So don't go anywhere. Who's this kitty, by the way? Elijah. We've got lots more coming up on Morning Live. Meet Lulu. Super excited Frenchie about 20 minutes ago, but because she's here for surgery, she just had some medicine too, so she's all like, yes, I am ready for my day. She's relaxed and having such a good time. Back with Sarah, we're talking about preventative measures. What do we need to do to get our pets ready for this spring and summer?
Yeah, so ticks and fleas are already out with the kind of warm weather rolling in. So now we want to have them on a tick and flea preventative. Starting in June, we're going to want to start having them on a heartworm prevention. Prior to them starting on a heartworm prevention, we want to make sure that we're testing for any tick-borne disease, heartworm, Lyme disease before they get that preventative, just to make sure that there's no concerns with them receiving it and that it's not harmful for them.
Right, and I mean, annual checks are really important. I know, because I take my dog for one, but you don't have to get like all the shots every single time.
No, so most of the time we try to make it so that they're due for at least one vaccine a year, but if they're not due for a vaccine, we still do recommend them coming in for a wellness exam. Just like people, things change really quick, so if we get them in for a wellness exam, we're listening to their heart, we're listening to their lungs.
That was going to be my next question. What do you do during a wellness check? That's okay. No, it's good. You're answering it already. I didn't even have to ask you. What do you do for a wellness? Like, do you take blood as well for a wellness normally?
Yeah, so normally when they come in, we want to do either just a heartworm test or a wellness panel, which is looking at their red blood cells, white blood cells, organ function, just to keep an eye on kidney, liver function, if there's any signs of diabetes or anything like that, as well as doing that heartworm and tick-borne disease testing prior to them starting their prevention in June. And then that way we can get a baseline if they're younger, and then we can do annual blood work to see if there's any changes going on.
Right, I do notice that they do check for diabetes, especially in my dog. She's older now, so they're really keeping an eye on what's going on with her kidney and liver function and all that kind of stuff. And because I see an RVT like you, it's I get so much information.
Yeah,
Which
that's
is-
what we're here for.
Yeah, and you don't mind that people ask questions.
No, that's what we're here for. We want to be educating the client as much as we can, because yes, they are obviously pet lovers, but they obviously don't know kind of things behind
Lulu
the
is
scenes.
living her best life right now. Look at her. She's like, oh. Well, if you guys give the attention that you have done to the animals that I have seen here today, this is a great place. Morgan Animal Hospital is where we are in Niagara Falls. Thank you so much, Sarah, for having us today.
Absolutely, pleasure.
Lots more coming up on Morning Live.